Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
As well as you know, Deacon Clint Walker, because there's been a lot of concern about the vaccinations and what to expect, and what we've witnessed of late is that the church has really played a major role in getting the vaccine to people who wouldn't otherwise get the vaccine. And so we were very interested in getting some feedback from your church. Actually, last week we had Dr. Kendrick Carey, who had done something like that in DC and Pennsylvania Avenue Baptist Church. And so we welcome the opportunity to hear from you and Reed Temple, the wonderful things that you've done there.
Thank you very much. I look forward to sharing what we have done.
Okay, well, whenever you're ready, I guess we're starting about, what time do your clocks have? Because my clock says 8:57.
Well, your clock is right.
That sounds like the church to me. Whoever's in charge is right.
And John's on, everybody. So he's muted.
Oh, wonderful.
The screen is on, but John is on, and so he's
Good morning. Good morning. Good morning. Good
How
morning.
are you, John?
I'm doing better. They're trying to control my blood sugar. That's the only problem.
Okay, all right. Everything else is okay?
Everything else is okay.
That's hey, Carol, that's John's perspective.
Just call me afterwards and I'll tell you everything. John's at Georgetown Hospital right now. So usually he's the host, but he told me everything to do, which is in his nature. And I'm so glad he's still bossing me.
Well, I always wonder who's taking care of Carol, because you're taking care of everybody else.
Took care of me. Trust me. I'm here because of Carol.
Yeah. It's tough to say no to Carol, isn't it?
Yes.
Well, looks like we have a full house though.
Yeah, got about 12 people. That's good.
See, he's still taking charge.
Anybody heard from Pearline Freeman?
No.
I'll have to give her a call, because usually she's I missed her the last two sessions. Got one of those potassium-rich bananas, huh? Good for your blood pressure.
Sure.
Yeah.
Oh, she's coming on now.
Oh, she is. Okay, that's good to see. All right.
This is a hard job.
Hello, Pearline. We were just talking about you. I missed you the last session, and I'm glad that I can see you this morning. Okay, we've got Pastor Whitlock on, who's going to just give us some ideas as to what's going on with Reed Temple and how they're trying to help us solve this problem with people getting the vaccine. And we had heard, I told them that we had heard from Dr. Carey what they were doing in Pennsylvania Baptist Avenue in DC. But of course, many people think that in Maryland things are way worse. But anyway, and it looks like we also have from Howard Clint Walker, who after he's also a deacon at Reed Tabernacle. And so after the pastor gives us an update, and we're going to hear from Clint, who's also a contract tracer, lead contract tracer in Washington, D.C. So, Reverend Whitlock, would you start us off?
Thank you for this opportunity. I have been appointed, I was appointed to Reed Temple about 18 months ago, following the incredible leadership of Reverend Dr. Lee Paul Washington, who really has done an incredible job, a wonderful job for Reed Temple, moving it from Penn Avenue, Michigan Avenue in DC to Good Luck Road in our present location, 11400 Glendale Boulevard. The church has given birth to several different ministries. We're excited about what we're doing. We love the partnership with Howard University. And today is a great opportunity for us to share what we're doing in regards to our Lunamus Health Doctors Medical Center Reed Temple coronavirus clinic, vaccination clinic. It really started, and I would love to have questions as we talk, because I don't have a formal presentation. So I'd love to have questions and have a dialogue, interactive dialogue. It started really back in March when the governor asked us to meet with several faith leaders about the challenges that the governor saw coming after the closing of churches and public facilities and everything back in March. And so we started meeting weekly, listening to the CDC, listening to I'm trying to say it correctly, the craziness coming out of the White House. I forgot I'm a pastor, so I got to be careful. I should have said the foolish.
But he's a capper too, man.
Yeah, to the day I die. Thank you, brother.
We've got your back. You got an AME here. We've got your back.
Thank you. So please forgive me. My tongue needs some salvation. And we were meeting, and it was amazing, the challenges from our evangelical brothers and sisters about we can't stop meeting. We need to have a meeting. We have to keep meeting in the sanctuary. Our stewards and trustees immediately said, no, we're shutting it down. And I talked to a friend over at First Baptist, Pastor John Jenkins, and Ebenezer, AME Church, and Shiloh, and others. And we all said, Bishop Peoples, and we all said, yeah, we need to shut it down. And then the challenges of operating virtually. Some of us understood Zoom. Now we are zoomed out. It's really hard to preach and sing. I think they should invent some type of software to get everybody singing on the same note in a Zoom call. It's quite comical. But we started pushing with the governor to make and help Reed Temple become a testing site. Never really got any feedback, never heard much. And we have been asking to serve as a testing site for months because of the great challenges within Prince George's County. And our members were asking, how do we find testing? How do we find solutions? But we never got a lot of traction, to be honest with you. Never got it. Still pushing people to go get tested. And I don't want to get too personal, but my mom in October died of COVID-19. She was 90 years old, and I'm not sure how COVID-19 got into the house. My brothers were visiting. They came from Texas and St. Louis. We did go out to a restaurant, but we were masked. But a week after they left, Mom died in my arms. And and I got COVID. My wife contracted COVID. Both my brothers COVID. Um, Interestingly enough, I have never taken a flu shot in my 66 years of life. It shows my intelligence level. I probably should have done it, but and both of my parents were in medicine. My first job was an orderly in a hospital, so at 16 I would take dead bodies down to the morgue on a regular basis. So I understood death, but but to watch my mother die in my arms, literally suffocating, um, in her own lack, in her from the challenges of her breathing, watching her going through some laborious breathing moment. I mean, it was and screaming pain and fear. Uh, that for me was difficult, and I had to take care of her while she was had COVID and while I had COVID. And my wife had COVID. My wife was unable. She lives with us. She lived with us, and my wife couldn't come down. I had to because she was too sick. It just pushed us to do more than even the whole testing. It was around that time. I'm talking now after the funeral, etc. I'm talking to Mayor Tim Adams of Bowie, and Mayor, I said, Mayor, I'm okay. I would love to get the vaccination. She said, well, Mark, go over to doctors, and they should be able to take care of you. I'm going to call the president of doctors so you can get in. And had an opportunity to talk with the president, and she and I, Richmond, became friends. Simultaneous to that, one of our health director of the Reed Temple Healthy Initiatives, Healthy Community Initiatives at Reed Temple, also was talking to Doctors Hospital. They were also trying to get my wife and I vaccination to get the vaccine. And so when I met with Richmond, when I met with the president, she said, we've been talking to Sharon Hawks. We also want to talk to you. Would you consider serving as a vaccination center? Yes, 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 absolutely. I mean, this is taking place during my shot. We're sitting in this little room at doctors and not in the office, nothing, no coffee, no silverware, no, yes. And I'm pulling up my arm, getting my shot. And literally, family, and I can call you family, within 3 weeks, literally within 3 weeks, maybe less, maybe a touch more, we opened up our vaccination center. What it revealed to us when lines, and some of you have been to Reed Temple, lines wrapped around the entire building. There was no fear from our seniors, and we have 3,500 seniors alone. We have almost 10,000 members, but it wrapped around our building in the code to get the vaccine. These were from every quarter of Prince George's County, and honestly, some came from Montgomery, some came from DC. But our goal was to turn nobody away. Nobody away.
The first day.
Yeah, nobody away. Nobody gets turned away. We found that we had to get them registered over the phone, but much to our dismay, this is what blew us out of the water. We had our membership, and we asked, would you please make sure that you don't create a public relations disaster for us, that we get our members vaccinated. We know you have some people you have to vaccinate too. We understand. And I asked, well, how large is your list? 110,000 people on your list. I said, well, we got to make sure because if everybody on your list will be here, amen. And I'll have a public relations disaster. And so we were able to create a percentage of those who were Reed Temple members. And we still had some bumps in the road, to be honest with you. The first weekend, Monday, Wednesday, we opened 4 days a week. And the reason we opened 4 days a week is because we still have our school, Reed Temple Christian Academy, and we didn't want to have any challenges. We didn't want to create problems with the parents. And so we're closed on Friday, we're closed on Monday, And so we opened for the school. The church is always closed, but they would come in Friday, Saturday, Sunday, and Monday. So the first weekend, we probably did close to 2,000 people. The next week, it was closed. Next week, closed. Uh, um, Mysteriously, we run out of vaccinations. We run out of vaccine. As you recall, the weather gets bad. We have to close. Nothing came from the South. Couldn't get the Moderna, couldn't get Pfizer. And so we have to close the vaccinations. We had to close the vaccine. We had to close it. We opened it up last weekend, and we could only open it up because they opened up another facility in Prince George County's Community College on Friday and Saturday. So we opened up on Sunday and Monday. On Sunday and Monday, we put 1,500 needles in arms and vaccinated. So we're opening up again this weekend, but it's only at 2 days because, again, the challenge of vaccine availability, but also it creates another challenge because some people, not so soon, but some people need to get their second shot. And so now we, again, are challenged with how many or how far into the marketplace are we able to offer vaccines. The hardest part about this process is not the management of Illumina's Health, not the management of the facility, but the perception that people think you got vaccine in the cupboard, you got vaccine in the closet, you got vaccine in the pastor's office. And then this other one is, hey, can you give me a hookup? I mean, it's like the hookup calls are amazing. I'm getting hookup calls from every place. Hey, Pastor, I know I'm supposed to register, but you know, you got the inside. And I'm going like, okay, you can't say no, but you're trying to be kind to everyone. We're talking to the Lieutenant Governor every day, sometimes 3 or 4 times a day. He has been incredibly resourceful. He continues to ask how many, he's offering for the metrics, how's it going? Let's see if we can do something. We believe once Johnson & Johnson comes out, we should be able to meet the demand. That's the formal presentation that I heard about this morning from Sister Carol Tatum. And so please know that's the best I can do right now.
I would like to say something. I'm Janice Stevenson, and Reverend Whitlock, I thank you and Reed Temple. I received my vaccine from Reed Temple. And as you said, you didn't want to turn anyone away. No. However, I was one of those who stood in line on February 15 for 2 hours. Yep. And got to the door. You have an appointment? No, but they let me in. Very orderly, very efficient. And I look forward to coming back on March 15 for my second vaccine. So thank you
very much. Thank you.
Thank you.
We had to create, thank you. We had to create a list because, you know, the real challenge, Sister Stevens, you know, is that you have to get rid of the vaccine the same day. And so what happened was that created another public relations challenge because now we're calling people at the end of the day, we got some vaccine left, come on in. And and then we found out that there were some networks in Bowie that were posting things on their network unknowns to us on their network and said, you can get the hookup at Reed Temple. You don't need an appointment, just show up. You know?
Right. That's how I got it.
Now, if I can.
Yes, Brother Clint.
Dr. Callender didn't warn me that my pastor was going to be at this meeting. So Reverend Whitlock. Oh, and Dr. Callender, you missed my actual connection with the church. I'm a trustee, and we don't have the deacons in the AME church are actually on the ministerial path. I'm a trustee, and and I'm on the, believe it or not, well, I guess you can believe it. I'm on the COVID committee at the church, but I need to kind of talk now because I'm still in time from the from the coronavirus cases. And if anything happens, if you hear my machine start going off, because we have to set up so that we're able to accept calls as well as make them. But I also served. There goes one. Rhea, let me call you back. All right, that's my daughter. She's a doctor at Howard Hospital, by the way. And Dr. Callender knows it. But I also served those first 2 days. No, actually, I served the Friday and Saturday, the first 2 days that we gave out a vaccine at Reed. So I can tell you that at the end of the day, when we closed the doors, there was one shot left. You laughing, but we don't want to waste one shot.
Right.
You know, so we made a call and got somebody in there to take that one last shot. But during the course of the day, I mean, Reverend Whitlock had the Attorney General for the state of Maryland. I mean, it was a big, it was a big thing. And as he said, everybody, it didn't matter who you were, how old you were, or where you came from. If you got to the church that day, you got a shot. Then the following days, we stuck to the one. We were doing 1As. We were 1C location, but we were doing, and I guess I need to explain what everybody's been categorized. So if you're at a certain age, you're in a certain group. If you're in a certain age with preconditions, you're in a certain group. So there's 1A, 1C, and 1B. Now we were designated as a 1C group, but we started out doing 1As, and the very first day we did everybody, and it was one of the most heartwarming things that I've been around at the church, to watch people come in, and we hear so much about vaccine phobia and vaccine reticence in the Black community. But when you look at the lines, if you're on television looking at the lines, if you look at what happened around our church, and if you look at it, Black folks, sure, we know that they abused us with the Tuskegee, with the Tuskegee research, and we know that we can't trust them, but Black folks want to get this vaccine. There's no doubt in my mind. And when you see the stuff on television, you see the lines going around buildings, you can see the Black folks really want to get this vaccine. Now, I will say that I do know a bunch of folks who don't want to get it, and I'm gonna tell you what I tell them, and you can tell this to your friends. When they call me and ask me, because I'm a contact tracer, and because I go to Reed, and because, believe it or not, folks, I am a student at Howard. I'm back again. I need to start by saying this, but I'm back again in school, and I'm working on a PhD in psychology. Unlike my pastor who got his PhD recently, I'm Dr. Whitlock. I'm still working on mine. And my daughter beat me to it. She's now a doctor at Howard Hospital. But what I should probably do is stop all that and get straight to the coronavirus contact tracing. But first, let me explain my connection with Howard. I came to Howard in 1966. You guys can't tell. Dr. Whitlock knows. I'm 6'8" tall. Howard offered me football, basketball, and track scholarship. My first year, I went out to Iowa like a dummy. Sending a Black kid to Iowa in 1965 was pretty much like putting me on the moon. I came back to Howard as fast as I could. The athletic director said, "Well, didn't we offer you football, basketball, and track scholarships?" I said, "Yeah." He said, "Well, you got to play everything." I said, "As long as I can come home, I'll play whatever you want me to play." Howard got me. I got back there with open arms, and I'm gonna tell you that. And you see, I got Howard, the founders behind me here. That it was the best thing that happened to me in my life. I went on. I helped build WHPR radio station. I managed WHPR for 20 years. Those of you who have been around long enough may remember me as the voice of the station. I'm the guy who used to say, "Washington has the ultimate in radio, WHUR." And that's what I did for the first 20 years after I graduated from Howard. At the same time, I taught in the School of Communications. And then for the second 20 years, I was a director of academic computing, so I'm something of a computer geek too. Dr. Callender can can attest to that. And I also taught multimedia computing for about 15 years. So I've had about every experience at Howard you can have. I've been a student. I've been the father of a student. My daughter got all three of her degrees at Howard, and I've been a teacher, and I've been a professor, and I've been an administrator. And it's very fortunate. And you know what? I got my shots at Howard. I got my second shot 3 weeks ago, and was very happy. And was very happy to get it. Howard called me and said, "Come on down here and get a shot," and I did. But I can tell you now that you can, if you're in Group 1A or 1B, you can pretty much get a shot any place in the city if you live in DC that you want to go to. If you live in PG County, each district, as Reverend Whitlock was saying, each individual jurisdiction is handling. So PG County is handling theirs, Montgomery County is handling theirs, but in terms of Maryland, it's being governed by the state, and DC is being governed by the DC Department of Public Health.
Tell us about those categories.
Say again.
Tell us about those categories.
I think I can probably look up and give you the exact part. 1A, I can tell you, is people 75 years and older. Those are that's 1A. And also, if you were in a congregate living facility, if you were in a nursing home, that was 1A. And then there were categories within 1A. Then it came down to 65 years of age and older, and whether you had diabetes, any of the underlying conditions. And underlying conditions include, I read this stuff every day to people, include COPD, asthma, diabetes, hypertension, chronic liver disease, chronic lung disease, chronic kidney disease. Those are the primary underlying, and cancer. Those are the primary underlying. Oh, and heart disease, chronic heart disease. Those are the primary underlying conditions, and those determine which you're in. I don't think anybody on this phone has to worry about which category they're in, because looking at everybody, it looks like everybody's at least in the 60s, I guess, and 60s are now being given shots pretty much in all the locales that I know of. Reverend Whitlock, are we down to 1C now? Or are we still doing 1B?
No, we're down to 1C.
Okay, so that means that if you're 55 and over, you pretty much should be able to get a shot anywhere. Does that answer your question, Dr. Callender?
Yes. Would you tell us just a little bit about what you do as a contract tracer?
Yeah. I tried to put together in fact, I know how to do this because, in class. So I'm gonna share my screen, and I need to share the sound, do that, and do that. So, share.
There it goes.
Let me see if you can see what I can see. Actually, I got some stuff up that's blocking me. All right, can you see where it says contact tracing?
Yes.
Now, I tried to put together a little presentation, but Dr. Reverend Whitlock, Reverend Dr. Whitlock, I can say it that way, has kind of said some of the stuff that I was going to say, but among the things I was going to talk about was what COVID is. Basically, COVID is an infectious disease that caused by this newly, and when you hear people talk about the novel coronavirus, they're saying novel because the coronavirus is relatively new. Now, most infected people who get this virus have have mild or moderate kinds of responses to it. And basically it's a respiratory illness. So that's why you heard in the beginning so much about people and about a shortage of ventilators. And in the early days, the medical profession was learning how to deal with this. They didn't know exactly how this thing was affected. And among the things that coronavirus tracing does is it kind of gives a better picture of who's being infected, how they're being infected, and what the infection actually looks like. So what we discovered is that older people and those with underlying conditions like cardiovascular disease, I just named them, diabetes, chronic liver, those are the people that have the biggest issue with it. As I said, most people for most folks it's mild to moderate, and I say that having like Reverend Dr. Whitlock, having lost a family member, and I think one of the things we should keep in mind, and Dr. Callender, you probably have a better handle on this than I do, is all the other deaths that are happening at this time. It seems like in this time period, we've had more deaths than we normally have. I lost a cousin. I lost a cousin in DC. I've lost a couple of cousins in Philadelphia. And the cousin I lost in DC was really tragic because she passed on the 4th of July and she had just gotten out of the hospital. And I got a call from her daughter saying that there were police down at her apartment. And she lives in an elderly apartment for Second New St. Paul Church. And my mother, oh, by the way, my mother is the mother of that church. And she's 96. She'll be 96 on Monday. My mother had gotten her apartment down there and I had to run down there and take care of that. Met the policeman down there. And one thing I want to say about this conversation I had with the policeman, I asked him, I said, it seemed like there's an awful lot of death taking place that's not COVID related. He explained to me that that was his job. He was the one who went when a death was reported, stayed there until a medical examiner came there and determined whether or not it was a natural source, natural causes or what. And he said he's been seeing, and this is in July, he said he had been seeing more deaths than he can ever remember having to deal with. So I'm saying that to say that as people were saying that the numbers of COVID were being inflated, I think when this whole thing is over, we'll find, and Dr. Callender, you correct me if you think I'm wrong, I think we'll find that more people died from COVID than has been reported. That's just the way I feel when I see all the death that's been happening around me, and what's been attributed to COVID and what's not been attributed to COVID. But so what exactly is COVID?
Transmission of SARS-CoV-2 occurs via droplet transmission, contact transmission, and aerosol transmission. Droplet transmission occurs when respiratory droplets produced when an infected person coughs or sneezes are inhaled by a person nearby. Contact transmission occurs when a person touches a contaminated surface and then their mouth. Transmission of SARS-CoV-2 occurs via...
Could everybody hear that?
Yes.
Yes.
It was going okay? I'm sorry to
Yes.
stop it. I meant to check to make sure you guys could hear and see this stuff.
Droplet transmission, contact transmission, and aerosol transmission. Droplet transmission occurs when respiratory droplets produced when an infected person coughs or sneezes are inhaled by a person nearby. Contact transmission occurs when a person touches a contaminated surface and then their mouth, nose, or eyes. Aerosol transmission occurs when respiratory droplets containing the virus mix into the air and are then inhaled. COVID-19 is stable for up to 24 hours on cardboard, 2 to 3 days on plastic and stainless steel, and up to 3 hours in aerosols, which include fog, mist, dust, air pollutants, and smoke. Therefore, it is possible to get infected by touching contaminated objects or through the air. The incubation period is the time between infection and symptom onset for an illness. Estimates for COVID-19's incubation period vary from 2 to 14 days. but it is generally assumed to be around 5 days. There is more debate about the latent period, which is the time between infection and infectiousness. It is now thought that people can be infectious before showing symptoms, and so the latent period is shorter than the incubation period. An imported case occurs when a traveler is infected in one area and is reported as sick in another area. Local transmission occurs if that traveler infects others, or if there is a cluster of cases locally and the spread is easily traced. Community transmission occurs when there is no clear source of infection. Infectivity can be measured using R0. R0 is important epidemiology jargon, short for reproduction number. It is the number of cases, on average, that an infected person will cause during their infectious period. So if R0 equals 2, then an infected person will infect an average of 2 other people while they are infectious. There are 2 important variants of the R0. The basic reproduction number represents the maximum potential of a pathogen to infect people. Basically what would happen if an infectious person entered a community with no prior immunity. The effective reproduction number describes the current vulnerability of a population, based on whether people have immunity thanks to vaccination or prior exposure. The effective R0 decreases over the course of an outbreak. Note that both basic and effective reproduction number depend on factors such as environment and demographics, in addition to the pathogen's infectiousness. The goal of public health interventions is to bring R0 down to less than 1, as this would cause the disease to die out over time. The seasonal flu has an R0 ranging from 0.9 to 2.1. There is a lot of debate about the R0 of COVID-19, with estimates from more recent data ranging from 2.7 to 4.2. The variance in these estimates is largely due to differing model assumptions and a lack of data. For example, models which assume the possibility of being infectious before symptom onset have estimates that are around 0.5 higher. These R0 estimates mean there is much greater potential for spread of COVID-19 than for the flu. How much greater? For the purpose of this example, let's say that the flu has an R0 of 1.5 and COVID-19 has an R0 of 3. After 3 cycles of infection, 11 people have had the flu and 40 people have been infected with COVID-19. But after 10 cycles of infection, this becomes 171 people with the flu and over 88,000 people with COVID-19.
Wow.
Okay, so let me see if I can get back to I'm going to stop sharing this. And I got to remember how to do that. Okay, pause the sharing. All right.
Red button. I think it's the red.
No, it's yeah, yeah, but not like this. But anyway, so let me see if I can tell you a little bit more about contact tracing. To say how I got into it in April, when I really was cognizant of COVID in late February, March. In March, my mother's birthday is March 8th, which is this coming Monday. The last time she was in her church, we had a birthday party for her, and she hasn't been back to church since. Now, this has really been uncomfortable for my mother. As I said, she's the mother of that church down the street. But in April, I sent email to the president of Howard saying that Howard should be at the forefront of this. Eventually, to make a long story short, eventually I got hooked up with DC Employment Services. They hired me, and they hired 508 coronavirus contact tracers by late August, early September. And I understand now why they hired that many, because rightly thinking, there was an expectation that there was going to be a big surge this fall and winter, and we needed to have a force to cover it. I am very proud of the fact that DC was out in front. DC was one of the first cities to come up that have coronavirus contact tracers force hired and hitting the ground doing something. So when we first started, and they hired me in August. When we first started, none of the other surrounding jurisdictions had any contact tracing done. So when we got people from Maryland and Virginia, we had to hold on to them. There wasn't anybody we could transfer them off. Only in the last month or so that we've been able to transfer people off into Maryland and Virginia as they bring their contact trace force up. I have to give Muriel Bowser all kinds of kudos. I didn't think a whole lot of Muriel before this, but after getting the contact tracing off the ground and after creating the Black Lives Matter Plaza, I think that she's just one fantastic individual. In DC, it should be commended. I checked this morning, and as of this morning, DC has had a total of 1,023 deaths. When you look at the national death rate of over 500,000, I mean, that's DC has been in real control. Now, people were asking, how come the rate in DC was so low? And all we could do was talk about what we do in DC and what was happening in DC. Now, some of you may or may not know that DC as a city has the highest per capita education. To me, that means that when they told people to wear masks in DC, people in DC, for the most part, put on masks. So when you hear about all these other cities with these high death rates and this high infectious rate, you didn't hear about that in DC. You heard very little about that in Maryland. You heard more about it in Virginia. And I think it's because, one, the mayor had a good plan. Two, the intelligence, well, let me not say that. The education level of Washingtonians was so much higher. But even 1,023 deaths. And I think about the people I've lost. Reverend Whitlock can tell you about more because our congregation spans more than just PG County. So he can tell you more about the deaths that we've had at our church.
We've had 125.
There you go. And when you look at what's happened in our community, there are some neighborhoods in this country that have had more than 125 deaths. I'm not saying, I'm just saying, I'm just looking at the difference because of how serious. And we had politicians who took this seriously. The Maryland governor obviously took it seriously. Muriel Bowser obviously took this very seriously. And the governor of Virginia is a doctor, and he took it very seriously. I don't. Okay, so let me go on. So what happens and how do we contact trace? Well, the law in DC and in the surrounding jurisdictions is that when you go get tested, if you test positive, it has to go to the Department of Public Health. Once the Department of Public Health gets it, we get it in our database and we call you. We call you to find out how you're doing. We want to know what your symptoms are, how severe your symptoms are, whether or not you've been in contact with someone else. During what that video said, during that 2 to 14 day period. And I can tell you that I've had people that we followed up to day 10 or 12. I have one person that I called and he was on day 12 and I had been talking to him. So we talked to, if you test positive, we try to talk to you every day. I called him and I've been used to talking to him, but he was talking to me almost in a whisper. And I said, well, man, how you feeling today? Yeah, I'm having trouble breathing. I said, well, call 911. No, I don't want to call 911 because people are going to the hospital not coming out. I said, that's not true. I had somebody come out of the hospital, and I had that very day, I had somebody come out of the hospital today, and he had cancer, and he was in the hospital, and he's out today. He said, no, he said, because I go in there. He said, but I can't breathe. I said, listen, I make a long story short. He wouldn't call. He eventually allowed me to call. And I stayed on the phone with him till the EMTs got there. And because he was saying, are y'all gonna put me on a machine? Once they put him on oxygen, he felt a little bit more comfortable. They took him off, and I can tell you now, I talked to his sister for the next about 15, 16 days. He went in the hospital, and he was in ICU for about a week or two, and then he was on a ventilator and what have you. And that's what we do as contact tracers. We follow the cases. I've only had a couple of cases that were terminated in death, and those, I don't know how you Dr. Callender, I don't know how you doctors handle it. Those cases affected me terribly. I don't know how my daughter does it up at the hospital, but those cases affected me terribly. You guys, you have to figure out a way to separate yourself from this, but that's what we do. We follow people. We don't only follow people who have tested positive, we follow contacts. Now, we ask people who are contacts of people who test positive to quarantine for 14 days. We ask people who test positive to isolate for 10 days. The reason is that once we have the positive test, we know for sure what their time period is. For the contacts, we're never really quite sure what their date period is, so we ask for 14 days. They've now narrowed it down to 10 days as long as the contacts are not exemplifying any symptoms. Pretty much that's how it is. I had a bunch of slides I was going to show you. Where is the diagram presentation? Can I bring it up? The presentation is here. I want to show you this particular slide. Can't get it open. Let me see if I can get this open. It's not gonna let me get it open. But 8 out of 10 people 65 years of age and older have 80%, I'm not saying it right, 80% of the people who have died are 65 years of age and older. So it's really the older folks who have carried the brunt of the worst part of this disease. Okay, I don't know. If you got any questions, I'll be more than happy to answer them.
One question I have, this is John Tatum. If you are a breast cancer survivor and you're over 70, what category are you in? A1, A2, AB, or AC?
Well, being over 70, you're in category A, 1A. If you could have been a 35-year-old and been a cancer survivor and still been in 1A. I am a 3-time cancer survivor, but that didn't increase my 1A. I'm also 73 years of age, so I was in 1A to begin with. Yeah, so any of the underlying conditions pushes you up to category 1A. So I don't know how, have you had your shot yet?
No.
Yes,
no.
you have.
Oh no, I'm talking about Candace Carter, Reverend Candace Carter. She's on the line.
Oh,
We're talking about Glory. Could you stop sharing your screen?
Can I stop sharing?
You have to do it, Carol.
Oh, I do it.
Yeah, up at the top.
I tried.
And
I
then
tried to.
And then Gloria can speak up about her situation. Unmute, Gloria.
Oh, okay. Yeah. Okay. Thanks, John. But it's Gloria. It's Reverend Gloria Gotti, not Candace Carter. You may have seen my cell phone come up as Candace. Yeah. I really appreciate everything. I'm just a little bit emotional as usual when it comes to especially my seniors. And I actually am an employee of the city of Bowie, but I've been furloughed for 1 year and without pay. And right now, I am being stressed out a lot because I'm receiving emails on my personal email because I am not at work saying that it is a mandate that we be vaccinated. I have no problem with getting vaccinated. I've always been a good team player because being a breast cancer survivor, I try to take care of myself. So I don't have a problem with that. But I have gone up online over 5 times. And the last documentation I received is that there is no vaccine. I have to keep waiting. However, I'm being pressed from my job to take the vaccine. And my mayor is Mr. Adams. Uh, and I'm just a little bit discouraged at this point. And I can tell you this, that as a breast cancer survivor and as a Christian, a minister of the gospel of Jesus Christ, stress is something I don't entertain. And I'm starting to feel very depressed and stressed over this situation. And I just hope somebody, it is not about who you are, how many degrees you have, what your status is. If this is a life-saving event and we can have a better life and we can survive better, I think that each one of us, especially when we are older, we ought to have an opportunity to get the shot. And I think I have to try to get over my emotions so that I'm able to speak better and maybe get this point out so that people will understand. I've been working with seniors for over 25 years. And I have seniors that are in their homes who haven't been outside since March of 2020. And they are afraid to go out. They have no one to take them to get the shot. They don't know how to navigate on the computer. I've tried to help them with that. But the stress will take some of us out. But I'm determined it's not going to do that to me. But I appreciate all that's been said today. But I'm hoping that my voice will be heard so that maybe we can find out what the real truth is. Because at this point, my trust is getting real small. So thank you for letting me speak. Thanks.
One of the things that I can say, can you hear me all right?
I can.
Yeah.
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 One of the things that I can say, because I've actually also sat on the vaccination line in DC, is that I would think that you should be able to get a shot right away. The question is register. Now, the reason for the registration is that they've got to track everybody, and they want to make sure that the most needy get it first. The issue is, and what we found out in DC, and actually DC is going to a completely different plan now. But what we found out in DC is that older people were having challenges getting on the internet and getting. So we also had a phone line open. So when I was sitting on the 2 days a week that I sat on the vaccine line, I handled phone calls, and I was always happy. You know, the first day I sat on it, I got 2 people registered. The second day I sat on it, I only was able to get 1 person registered. But every time I was able to get somebody registered, I was very happy. Now, look in these. If you're in DC, you can go online and register. If you're in Maryland, well, if you're in PG County, you can go to Reed Temple. And Pastor, you can probably explain this better now. But if you go to Reed Temple, before you can even get to anything on Reed Temple's page, a thing pops up and says register for the vaccination. I mean, you can't even see. You go to reedtemple.org, and you can't even see what's happening on reedtemple.org before this thing pops up in front of your face and allows you to register. So you don't have the
I've been there. I've been there.
Yeah,
I've
okay.
been on the phone line. I've done all of the above.
Me too.
So what Reverend, as I said, if you would send me your name, I said it on the chat, and your email, I will personally work with you.
Dr. Whitlock, these people might not even know there's a chat line on the side. They may because they're looking at Zoom. They may not see the chat.
So Reverend Gloria Gaddy, I'm so sorry that you've experienced this, and we understand the pressures of serving as a minister of God, a minister of all believers. Please, if you would, take down my cell phone number, 323-855-8076, 323-855-8076. Send me a text message with your name and your email, and I promise I'll get back with you. All right?
Okay, thank you.
And I will be praying with you. And when you text me, fine, but I want to call you and let's have a prayer together, because you carry so many people on your shoulders. And then you said it's been a year of furloughing without pay. That means you've tapped into your retirement account. You're challenged. And so without going into a ministerial session right now, please understand, we do understand. And let's for sure, I want you to call me for sure. Is that all right with you?
I will do it. Thank you, Pastor.
God bless.
One footnote I'd like to add to this is that about 4 weeks ago, my mother has Kaiser. As I said, she's 96. Kaiser called my mother and told her, and I saw you stick your hand up, Mr. Buchanan. Did Kaiser call you also?
Kaiser called me, Kevin.
Yeah, and so I've been called. Now I've also had an operation in the last 2 years at Hospital Center, and Hospital Center has been bugging me to come. I've got both my shots already, but Hospital Center has been bugging me. So if you've had any recent stays in the hospitals I think are reaching out to you. Kaiser is one of the only medical, and I think because of the way their health insurance is set up with having to go to them as a clinic, Kaiser is notifying people, and they keep calling my mother to go back and get a shot. So there's shots available. It's just trying to navigate the process that folks are having difficulty. But,
want to wash up at all, okay?
Okay.
Do you want to wash your face or anything?
Yeah.
Yeah, I'm gonna wash it for you.
okay.
Sure.
So, but anyway, if you're having issues, persevere. The Bible talks about perseverance. You can get through this. I don't know, Dr. Callender, does it matter? I mean, if you're in DC, I can help you. And if you're in PG County, Reverend Whitlock can help you. Other than that, I don't know. Anybody else other than Reverend Gaddy still trying to get a shot? Just hold your hand up so I can see.
Yes. Yes.
So we got.
Well, let me say one thing. Each week, the past few weeks, I've been mentioning they keep advertising the mass vaccine site, Six Flags. Right across the street from Six Flags is a senior center. As I said, I received my shot through Reed, but I've registered so many places. When they've been calling these past couple of weeks, I refuse. I have mine, but I tell them about this particular senior center. Lo and behold, this past week, Six Flags came to the seniors. They registered one day, came back another day to give them their vaccine. It's a senior center. Those who could not come to the resort center, they went door to door. A couple of days ago, they had more shots. I sent my 2 30-year-old nieces there. So what I'll do in the future is let the transplant team know of vaccine availability.
Hello.
I do know
Can you
this
hear me?
weekend, they said that they would come back and they will do it again. As soon as I know that and it's confirmed, I'll put it out there. But I was just amazed and blessed that they did come to the seniors and they did everything they could to make sure everyone was vaccinated. But they have been having surplus. So I'll let it be known next time.
Okay, the two people that are online that still need it, Dolores walked away, is Pearline
Yeah,
and Dolores
I'll
Saunders.
call you.
They're both are in DC.
I'm in DC. And I've tried several places of getting on the list and nobody is responding back with me. So I thought I was going to get it at the dialysis center, but they didn't come through either. So I'm still trying to get the vaccine.
It
Dr.
is
Callender,
difficult. It is difficult.
Can you send me the phone numbers of the two people, Dolores Saunders and Pearl?
Sure.
Dr. Callender?
I can send it to you
They
right
can send
now.
it to you themselves.
Oh, okay. My email address is cwalker@BUR, that's Beta Uniform Romeo, WAL, that's Whiskey Alpha Lima, BURWAL.com, cwalker@BURWAL.com.
My hands up.
And the only reason that I'm dividing it up into jurisdictions is because this thing is being handled jurisdictionally. It's being so if you're in PG County, primarily if you're in Maryland, contact Reverend Whitlock. If you're in DC, you can call me. Now I can tell you that the hospitals and actually the teaching hospitals, Georgetown, Howard, and George Washington, all have vaccines. But you have to register for it.
I tried.
To get in. And the registration part is getting lighter and lighter. If you register in DC as of last week, the registration got so light that there was nobody at the end, but you have to persevere. You have to stay there and keep trying. But I'll try for those names that I get.
Can you put your email into the chat, please?
Sure.
Thank you.
Vera had her hand up.
I've registered. Can you hear me?
Yes.
I've registered several places. I live in Laurel. Nowhere in Laurel are they giving any shots. I've registered several places. I cannot go to Reed Temple and stand in a line because I have a bad knee. And it was too cold. I have rheumatoid arthritis.
We got
but I can't
chairs.
get
You don't
a shot
have to stand up. We got chairs, and as near as I can tell, other than that first day, we really haven't had that long a line. Other than the first day, it's been Dr. Whitlock.
At Reed Temple, it's no line.
No, I can't say that. But what we can say to you is that the trustees are working, and Clint is one of the leaders of the trustees, on how we can keep people from being outside. And then we are providing times that you can come in, which has cut down the line. The first day was pretty intense, but now what we're doing is making sure people have time, appointment, a registered time for an appointment. And we do have many chairs for you to come to sit down.
Well, my son tried to register. My son did register me, but he said, Ma, you have to wait for someone to call you. I never received the call. I went Reed Temple myself, registered, never received a call because I cannot stand out in the cold for any length of time. The cold affects me now. I'm 77 years old.
I was at Reed Temple this past Sunday in the rain, and people that were working there took care of people that were in walkers or whatever. They ushered them inside. It was very well organized and efficient.
I have to agree. The time that I went to, Reed Temple staff came out. If you're very senior, walkers, canes, they would not let you stand outside. They invited you in. I had to wait 2 hours, but those that had a disability of any sort or senior, they invited you in. But I will check at this place, the senior center across from Six Flags, and I will put that information out once they become available again. And it should be this weekend.
Bullock, I'm so sorry you had a bad experience. If you allow me personally to help you, I will.
Okay, I'll send you a text later.
All right, thank you.
Yes, Pastor Whitlock, if I may, I hear us, and I do want everyone to understand. I even have a daughter that works in healthcare who works for a big company, and she was like, Ma, I can get you in, I can this. My point is this, I am not just advocating for me. I'm advocating for all. We must have some empathy. And I'm hearing people saying things, well, I didn't have a problem. You know what? We've got to do better. That's all I'm saying. Believe me, because God knows my faith does not waver. My faith don't waver. And I don't just work for me. I am really an advocate for everyone. So let us try to think of some way through Alsa Brooks. I have personal contacts with the government. I've been doing this, like I said, for a long time. And I don't want people to feel like you want to do something especially for me. I want us to be better by all.
The church, the thing is open.
Well, this is Dolores, and I'm sorry I had to step away, but I've been trying to get a senior an appointment for 3 weeks, and I was on the phone with DC government finally, and they had no more appointments. But what the lady just told me is that if you call at 8:55 a.m., if you live in DC, and get in the queue at 9 o'clock, they will take you and give you an appointment.
Put it on the thing.
And I mean, it's awful, but they have to do that. She said the same thing online. You have to get in early enough before 9 o'clock so that you can just go right in. They had 5,700 available vaccines, but only 3,000 people could get in. And by the time the 3,000 got in, now all of them are gone. But they're opening them back up again tomorrow. But she said, be on early enough, 5 minutes before time, to get in a queue so that they can process.
Now that used to be a secret about the 5 minutes before time. But let me say this: in DC, you go to that website, and the website is coronavirus.dc.gov/vaccinate-DC. That's the website. Right. Now you can go there 24 hours a day, and it'll come up and it'll say no appointments. All right, but underneath that is a place where you can register, and they will send you emails. I'm still getting them. I'm still getting the emails, and they'll send you emails on Wednesday, Thursday, and Friday, and remind you that you need to be online to try to get those shots. Now, what DC has now done is that they're now concentrating on certain zip codes. So there's certain zip codes that they, where they figure people are not getting the kind of coverage that they need. So they're focusing. So I can tell you right now, wards 5, 6, 7, and 8 are definitely in those zip codes.
Hi, Chaplain Maya Thorpe. Can I speak?
Speak.
Okay. Mr. Whitaker, I'd really appreciate that all the information you're giving. And of course, Mr. Walker, I'm sorry, I'm saying Whitaker. We both same age, so, I agree with you 100%, okay? And Bread for the City in Washington, D.C. I have a brother who's disabled completely, okay? His mental level is that of a 1-year-old. And that's where he goes to the clinic for more than 30 years. They take him there. They are excellent. All I have to do is just no computer. I don't know how to use computer. All I did was call, and they made an appointment for him for both days. Wonderful. I was shocked, and So
So Maya, do you have to be disabled to go there?
his primary doctor is from Bradford City.
Oh, okay.
You know, I don't know anything else. And that doctor is very nice, Dr. Randy Abramson, you know, and all just phone call, that's all it is, you know, because they have a lot of homeless people that come there, you know, they don't have all these, you know, computers and all that. And for me, I'm 73, I live in Montgomery County, and I know a lot of you told me go to Reed Temple. When I put the Reed Temple vaccination, it said the priority was for PG County and Anne Arundel County. So I, as a chaplain, I am not going to take somebody's spot. I'm going to follow the rules. So I said, no, I'm not going to go there. That's not what God wants me to do. I'm going to wait for Montgomery County. And my husband registered me for many, you know, everywhere in the Montgomery County, and also drugstore, you know, People's Drugstore, CVS, I'm sorry. And God has given me the Pfizer vaccination on Friday last week. And 2 weeks from now, I'll get my second one in the CVS in Montgomery County. No cheating, no nothing. I said, I'll wait. I'm not going to go anywhere. So
I would like to add one
provides.
thing, and that is that the best thing you can do for yourself is to continue to wear a mask, continue to wash your hands, even after you get the shot. Now, I've had both of my shots, and I'm probably expecting to get a third shot because of these variants.
Oh yeah.
I've had both of my shots, and I have a card that I carry in my wallet that shows that I've had both of my shots. And those of us who had the shots know that they give you these cards, and the card is primarily to let the people know that, you know, what shot you got, because you want to get both of the same shots, and it's got your date on it so you can't forget anything. But even after you get the shot, you know, you have to, because people, you be walking down the street and people and not wearing a mask, people think, well, what's wrong with you? What makes you think you're special? You know, so you want to continue. You've already had your shot. You want to continue to wear your mask, continue to wash your hands. Because actually, believe it or not, you can still carry, even though you've had the shot, you can still carry the virus. You can still infect somebody else. So, I mean, because you can have it on your clothes, you can have it on your phone, you can have it on stuff. So you need to continue to maintain the social distancing and wash your hands and wear that mask. And Dr.
Thank you very
Callender, I got to go because my computer.
Okay.
I
want to thank you and Dr. Whitlock for broadening our horizons and answering all the questions. We're deeply indebted to you for taking the time out and demonstrating the sensitivity and empathy that is so important to all of us. Thank you so much.
Thank you very much. Thank you for the opportunity. I'm looking forward to hearing from Reverend, and I don't see her on the line anymore. Did she leave?
Gaddy.
Oh, Reverend Gaddy. Please, Reverend Gaddy, I look forward to hearing from you. God bless.
I will call you back.
Whitlock, before you leave, on behalf of Metropolitan AME Church, I'd like to thank you and Mr. Walker for allowing many of our members who are Prince George's County residents to get vaccinated. I'm on the steward board at Metropolitan, and just want to extend a thanks to you for doing this. It's quite a service and quite in the tradition of the AME Church. So, and this is a social justice issue. It's absolutely a social justice issue.
It is definitely pulled a lot of it.
Yeah, so we really, really appreciate what you're doing. Thank you.
Thank
and
you
also, I'm from the 5th originally, so.
Oh, that's where I'm from.
I know you're saying. One of my good friends told me you were coming, so.
Oh, bless God. Thank you, everybody. Look forward to a partnership. Clinton, great job today, Clint Walker.
Great.